Nancy Rubenstein. I'm a psychiatrist, and I practice in a private office on East 31st Street. I came with a back spasm. I came originally with a back spasm, and in looking at the back spasm and taking x-rays, he saw this other problem I had, this stenosis. And I said, yes, I've had that for years and years and years. I didn't know if there was anything to be done about it. The back spasm cleared up on its own. But that was in my mind then, to do the surgery for the other, more long-standing problem that I didn't realize I could treat. That's what happened. I had an L5-S1 fusion, a minimally invasive procedure done on June 25th this year. The procedure I had, I didn't realize it at the time, was much simpler than the traditional procedure, where I would have been apparently out of work and not, incapacitated somewhat for 6 months. This was kind of a breeze compared to that. So I didn't realize that there was such a contrast between this, I guess, newer procedure that I actually had and what they'd traditionally done. If I had been out for 6 months, I'm not sure what I would have done, because I'd had this problem for so many years. It was uncomfortable, but the way I managed it was just by sitting down or bending over when it hurt me. And, it didn't prevent me from doing anything, it just interfered. But when I found out it was a relatively quick recovery, then I was all for it. I was one night in the recovery room. They didn't actually even move me to a floor. I left after one night. I literally walked out of the hospital. I wanted to get out of there, and I was able to. It was really fine. I'm not kidding that I walked out. No wheelchair, no nothing. I was in pain, but it was not terrible. In the hospital they gave me Demerol, I believe, or something like that. They gave me something IV. But I don't remember it being, a miserably painful experience. And I think it was only about for the first week. He told me that after the first week, that there would be pain for the first week. The second week I'd feel better, and I remember thinking that I did. And then after 2 weeks, I went back to work. Oh, definitely. I would definitely recommend it, because I've had an excellent result. He's extremely charming, likable, capable, caring. He's a very good guy, and I presume he's an excellent surgeon and held in high regard. And everything he told me would happen happened the way he said. And as I said, I didn't even realize I was getting this kind of newer procedure. If I had done more investigation and realized that there were choices, I still would have gone with this procedure. So I kind of lucked into somebody who was, I think, outstanding. And, I feel very happy for it. And if I have further back problems, I will definitely come back to him. So I would highly recommend it.